Hello, my name is Blake Gardner, and I'm the superintendent of the Hill City School District. And thank you for taking some time to watch this. If you have about 15 minutes, we'll go through the current update for the Hill City School District with COVID and our COVID plan. The very first thing I want to do is, and if you get nothing else from this PowerPoint, I hope you remember this. And it's a heartfelt thank you. Let's take a moment to celebrate. We are at semester break. We are at the midpoint of our year. We have done a phenomenal job. We have had minimal cases, minimal disruptions, and it wouldn't be able to happen without awesome kids. They're the reason this is happening. But phenomenal staff members, a really solid, strong school board, and just a wonderful community. And while we might disagree sometimes on the way to do certain things, I think the support has been unwavering. There has been solidarity and unity that we all believe school is certainly the best place for our kids. So thank you. This slide is our COVID dashboard of today, 12/18/2020. And as you can see, the elementary school has 0 active cases. The middle school has 0 active cases. The high school has 1 active case, and it's the same case that was active last week. They have not cleared the 10-day isolation yet. And we do have 1 new staff member that was active this week, which leads us to a total percentage of under 1%, it's 0.4. So 99.6% of our school community does not have COVID-19 at this point. Attached are a couple charts, and just like in Thanksgiving, I want to show you some of the Department of Health data. This is for South Dakota as of today, 12/18/2020, and this shows the trend lines. And you can see that we are definitely trending downwards in South Dakota, which is awesome. At the top, there's the orange and blue boxes. The 435 confirmed cases is really great. And the center one shows the active cases. We're at 8,773 active cases as of today, which is remarkable because just a couple weeks ago we were at 22,000. And the odds of running into somebody that was COVID positive was very, very high at that point. And it still is with 8,773 people, but that number is truly remarkable, and it shows a major downward trend. And just hope that we continue that trend as we head into Christmas break, and that we remain vigilant and keep COVID trending downward. And on the far right, that blue box that says how many are currently hospitalized, 387. That's a really encouraging number. Even just yesterday, it was, I believe, 480. And so less people are being hospitalized, more hospital beds are open. And I know that even just the healthcare system being able to do infusions and different treatments to prevent people from getting to a very severe place with COVID-19. So again, very encouraging, and I just want to thank all of our healthcare workers just for being heroes. All right, next we're going to look at Pennington County, so localize it just a little bit more. And if you look at that top left chart there with the orange 7-day moving average, you can see that we are definitely trending downward in Pennington County. We peaked in the middle of November, and then just a more detailed graph is below that one. And so certainly we're happy with the trend lines in Pennington County. And every day after I check the South Dakota stats, then I check Pennington County, and then I always like to check Custer. They're our neighbors to the south. Many of our students and staff are from there, and luckily their trend lines are very consistent to what Pennington County and South Dakota are seeing, with a decrease in active COVID-19 cases. This is an interesting graph that shows the amount of cases reported in South Dakota. These are the active cases from the beginning of the pandemic. That's the top graph, and the bottom one is the amount of deaths that we've had in the pandemic, and it's broken down by age group and age demographic. So you can see that the 0 to 9 and 10 to 19, which is primarily the age of a student, we've had about 13,600 cases, it looks like, and luckily we have not had a single fatality in South Dakota. And really, the mortality rate or death rate, if you're below 40, has been very favorable with COVID-19. And I put a note on the left-hand side. There's a bullet that says, you know, of the 1,301 deaths in South Dakota, almost 80% are in that vulnerable population of 70 and above. And so I think it's important that we figure out how we can protect that population, but again, have our students here in school. And then I did make a note also that while the mortality rate or the death rate is very, very low, the morbidity rate or the rate of lingering effects is about 20% of people have effects that hang around even after their 10-day isolation. And this could be, you know, if they lost taste or smell, they might not get it back for quite some time, or that shortness of breath that is associated with COVID-19. So I do think it's important that we're aware that the mortality rate, the death rate is very, very low, but the morbidity rate is high. A lot of people are having lingering effects from COVID-19. All right, so what is next? And certainly we're going to take a moment to live in the moment and celebrate where we're at in the semester break. And we've had very few cases in our district, but I do think it's important to stay vigilant, avoid that pandemic fatigue, and continue to do the things that have helped us have very few cases. This graph shows a chart of the last 5 years, and it's a percentage of people that report ILI, or influenza-like illness. And you know the flu symptoms, and those symptoms are consistent with coronavirus. And so as you're doing your daily screening, they might kind of look like each other, those symptoms. The orange line on the graph is actually 2020. And so the numbers at the bottom represent the weeks. So you can see we're in week 50 of 2020. And that orange line shows that we have, recently been below an average influenza season or influenza-like illness season. And my understanding is COVID is part of that as well. That's charted there as well. But I'm not going to focus on that. What I want to focus on is the nature of the graph. And as you can see, the graph spikes in week 5, week 6 of the new year. And so while I'm very, very excited where we're at, I'm going to take a moment to celebrate 2020 and Christmas break. I do think our next milestone is going to be the end of January and early February. And that's the next hurdle that we have to get over. So as we come back in the second semester, let's remain vigilant. Let's avoid that pandemic fatigue, and working together, I know that we'll keep our cases low. All right, as we move into the second semester, we did update our COVID plan a little bit. We changed some things just to try to make it more relevant. We want to evolve as this whole situation evolves. And what we did, first of all, was we wanted to define the phases. The phases have always been there, but we never had a catalyst or a threshold to move us from phase 1 to phase 2, phase 2 to phase 3. Again, nobody has a crystal ball, but man, I'm going to do everything I can to keep us in school and out of phase 3. But these are some approximate percentages. I do think it's important to note that, the circumstances will determine the phases more than the percentage. We're going to take a lot of factors into account. But one bit of advice the Department of Health gave us when we were creating these plans was do not become a tyrant, do not fall to the tyranny of percentages, I think is how they said it. Simply meaning that, 6% in Edgemont is different than 6% in Sturgis. So the percentage alone can't tell you everything. There's a lot of factors that we have to take into account. You can see the updated changes on our school website, but this is just the thresholds from phase 1 to phase 2 and phase 2 to phase 3. All right, the next amendment to this was on the protocol for COVID positive individuals, and a lot did stay the same. For example, if you test positive, you're still expected to isolate for 10 days. There's no getting around that. The biggest change is that bullet point down at the bottom where it says students are identified as a close contact. Typically, we had a 72-hour from their last exposure. And if you remember, our rationale for that was we're trying to weigh the risk of COVID transmission with the individual student's mental, emotional, social, and academic well-being, which we think is very, very important, and that's why we went with that 72 hours. Sanford Health supports that belief with their recent data that showed less than 10% of kids are getting COVID-19 at school. That transmission rate is extremely low, and that supports that kids really typically are not transmitting it sitting next to each other in history class or on the playground or in the school building. School is a safe place for our kids. But what we are seeing is that from household contacts, about 50 to 60% transmission rate. And so that's really the biggest change to this is if someone in your household has COVID-19, we're asking our students to quarantine for 7 days. And if they get a negative COVID test, they come back after 7 days. If no test, they can come back after 10 days. And parents, we really need your help with this, letting us know if you have any COVID positive test within your house. Again, this can all be found on our district website, www.hillcity.k12.sd.us. And one last thing as we approach Christmas break. Last year, I just loved getting out of the office over Christmas break and getting out into the community and engaging our stakeholders and just putting myself out there, allowing you to come chat, share ideas, maybe just have a cup of coffee with me. But I was available throughout break at the Hill City Library, at the Hill City Cafe, at the Hill City Visitor Center, and then at the Keystone Community Center. So a few different days I was out and about. With COVID, I'm not going to go out and about in the community, but you can see that Zoom link up there. I'm going to have an office hours, so if anybody wants to get on, I'll just make it a live Zoom meeting. You can just click to get on, and if you want to chat about anything, if you have issues about anything, or you just want to talk to me about your holiday plans, I'm here to listen. But I do want to make myself available, and I really will miss not being able to get out and go to the library, the cafe, or the visitor center. But this is, I guess, the next closest thing in 2020, and hopefully Christmas 2021, I'm back out in the community. And finally, thank you for watching this video. Definitely Merry Christmas and Happy New Year. This moment in time is not a victory lap, but it is a moment to stop and reflect and be proud of where we're at. We still have a semester to go, and there's a lot of things we still need to work on, but I am so proud that we made it to this point, and I just want to thank you from the bottom of my heart, and I hope you have a great break, and we'll see you back at school January 4th.